We recognize that the work we do takes place on the sacred lands of the Anishnawbe Robinson Superior Treaty of 1850. We acknowledge that we're in the traditional territory of the Fort William First Nation.
We fully recognize that Indigenous peoples face unique challenges in accessing healthcare in Ontario. Whether an Indigenous patient resides in Thunder Bay or travels here from a remote or rural community within the northwestern region of Ontario, we must consider their diverse needs when providing care at the Thunder Bay Regional Health Sciences Centre. We understand that patient relations can go beyond our regions and will work with patients and families to ensure they are connected. The Indigenous Care Coordinator role addresses the needs and gaps in the hospital system for Indigenous patients. The ICCs provide a range of health and mental health navigation, advocacy, discharge planning, and other support services in order to transition admitted patients to additional care or back into their homes or communities by working with local, regional, provincial, and federal supports. Indigenous Care Coordinators play a significant role in building and maintaining community relationships. They act as a contact within the hospital system for the patient's circle of care, ultimately improving the hospital experience while providing culturally relevant patient-centered care.
The hospital can be an uncomfortable and lonely place for First Nations, especially for those that have to travel a long way to receive health care. By providing care, wellness checks, and supports that are culturally relevant and sensitive to our Indigenous patients and their families, we can greatly improve patient experiences. It is important that they know that we are here to support them when we can, or to help reach out to anyone they may need to support them, whether it's a family, friend, community member, or any other Indigenous services.
We can assist by providing a range of health and mental health navigation, advocacy, discharge planning, and support services for Indigenous patients at the Thunder Bay Regional Health Sciences Centre. The most common services we provide are translation services in Cree, Oji Cree, and Ojibwe, iPad lending so patients can reach their loved ones, participating in bed rounds to support patients and nursing staff, navigating non-insured health benefit issues, linking patients to traditional care practitioners, spiritual care providers for prayers, or supporting traditional practices that can be done in our spiritual care room. We help support discharge planning with the patient's healthcare practitioner and community healthcare team for ongoing health services that are available in their community or region. We will work with the discharge planner by processing referrals to make sure those services are in place before getting discharged from the hospital. For example, making necessary arrangements for assisted living, respite, placement of names on waiting lists for facility care, and liaise with service providers and suppliers to arrange medical equipment and devices. We will work with our community workers with any additional supports the patient may need.
Indigenous Care Coordinators, or ICCs for short, work within the hospital to provide support services to Indigenous patients and families who are admitted in the hospital. The ICCs are also able to see the patients who are not supported by Indigenous patient navigators and the DELICO discharge planners, but can also provide additional supports if we are requested. There are 5 Indigenous patient navigators who are designated to the respective department. 2 in the renal department, 1 in the cancer center, 1 in the Center for Complex Diabetes Care, and 1 in the emergency department. We all work together in providing what is best for the patients.
Indigenous patients can access Indigenous Care Coordinator services in a few ways. During the hospital admission, Indigenous self-identification is asked to voluntarily self-identify as Indigenous. This is when a patient is entered into the hospital system and records. The self-identification generates a patient list for Indigenous Care Coordinators. Indigenous Care Coordinators can also receive referrals by patients, hospital's Indigenous Care Coordinators email, patient's health team including the patient flow coordinators, registered social workers, physicians, family, and their community. The patient themselves can also request to see Indigenous Care Coordinator through the nurse or any health team provider. Additional information on supports and resources can be found on the Thunder Bay Regional Health Science Center webpage under Indigenous Care Information, or call 807-684-7922 for more information.